If we were in NATO, we could afford free healthcare here in America. I'm gonna say something that's gonna piss off a lot of Americans. I believe that you can afford on today's Medicare and Medicaid budget to cover 80% of Americans. My family worked in med tech. When it came to selling products to hospitals, they got to learn a lot about the American healthcare system. Can you please explain to me that whenever the government pays for the same product that a company sells in the pharmaceuticals, the government tends to pay 5 to 35 times more than a private? Meaning, if I go to a pharmacy, pay like a regular human being with my money, I'm gonna pay 10. If I go to the pharmacy and have Medicare or Medicaid, why the hell is the actual cost of that medicine between my out-of-pocket and the government 5 to 35 times more? Please don't tell me that this is not true. I've seen this firsthand because of my background. There's literally TikTok accounts of pharmacies showing you the difference between an out-of-pocket expense of a private customer and a person that has Medicare and Medicaid. If Medicare and Medicaid pays 5 to 35 times more than the average payer, then they could cover 5 to 35 times more people on the same budget. Right now we're covering 60 million. If it was 5 times more, we'll cover 300 million. That's almost all of Americans. Knowing that the difference is 5 to 35 times more, I'm pretty sure we could cover most of Americans, especially when it comes to just medicine, not even like the surgeries and stuff. This is why I'm kind of pissed. Doge should look into Medicare and Medicaid. I think that that's where Doge should look into inefficiencies. They could choose two paths. They either keep the same budget and cover more Americans, or they use all the saved money from this stupid inefficiency between private and public to repay the debt. And in both cases, you still cover the same amount of Americans, so nothing changes, while paying off the debt. In the other, you help millions more of Americans on the same budget.